Welcome to M Health and Info, your ultimate source for all things health and wellness. Join us as we explore the latest in medical science, debunk health myths, and provide expert insights to empower you on your health and wellness journey. Hit subscribe, ring the bell, and let's explore the world of well-being together. This is M Health and Info, where knowledge meets vitality.
A stroke, also known as a cerebrovascular accident, CVA, occurs when blood flow to a part of the brain is interrupted or reduced, depriving brain cells of oxygen and essential nutrients. As a result, brain cells begin to die within minutes. Strokes are medical emergencies that require immediate treatment to reduce the potential for brain damage, disability, or death. Strokes are one of the leading causes of death and long-term disability worldwide, making it a critical condition to understand in terms of prevention, treatment, and recovery. There are two main types of stroke: ischemic stroke and hemorrhagic stroke. A third, less severe form is known as a transient ischemic attack, TIA, often called a mini-stroke, where blood flow to the brain is temporarily interrupted. Types of stroke. Ischemic stroke. This is the most common type of stroke, accounting for about 85% of cases. It occurs when an artery supplying blood to the brain becomes blocked, typically due to a clot. There are two main causes of ischemic strokes. Thrombotic stroke. A clot forms in one of the arteries that supply blood to the brain. This usually happens in arteries that have been narrowed or damaged by fatty deposits, a condition called atherosclerosis. Embolic stroke. This occurs when a blood clot or other debris forms away from the brain, usually in the heart, and is swept through the bloodstream to lodge in narrower brain arteries. This type of stroke can be caused by heart conditions such as atrial fibrillation. Hemorrhagic stroke. This type of stroke occurs when a blood vessel in or around the brain bursts, causing bleeding in the brain. It accounts for about 15% of all strokes, but is responsible for a higher proportion of deaths. Hemorrhagic strokes can be further classified into intracerebral hemorrhage. This happens when a blood vessel within the brain bursts, leading to blood leaking into the brain tissue. The pooled blood causes pressure on nearby brain cells, impairing their function. This is often caused by high blood pressure, trauma, or a malformation of blood vessels, like an aneurysm or arteriovenous malformation. Subarachnoid. Hemorrhage. This occurs when there is bleeding in the space between the brain and the surrounding membrane, the subarachnoid space. It is often caused by the rupture of an aneurysm, which leads to sudden and severe headaches. Transient ischemic attack, TIA. A TIA or mini-stroke occurs when there is a temporary blockage of blood flow to the brain. Unlike a full stroke, a TIA doesn't cause permanent damage, as the blockage resolves on its own within minutes to hours. However, it serves as a critical warning sign, indicating a high risk of a future stroke. Causes and risk factors of stroke. The primary cause of strokes varies depending on the type, but several risk factors increase the likelihood of experiencing a stroke. These include high blood pressure, hypertension. Elevated blood pressure is the most significant risk factor for both ischemic and hemorrhagic strokes. It damages blood vessels and increases the likelihood of clot formation or vessel rupture. Heart disease. Conditions like atrial fibrillation, heart valve defects, and heart attacks can lead to blood clots that travel to the brain, causing an ischemic stroke. Atherosclerosis. The buildup of fatty deposits, plaque, in the arteries can lead to the narrowing and hardening of blood vessels, increasing the risk of ischemic strokes. Diabetes. Diabetes increases the risk of stroke by damaging blood vessels and making the blood more likely to clot. Smoking. Smoking damages blood vessels and increases blood pressure, both of which raise the risk of stroke. Obesity. Being overweight contributes to several stroke risk factors, including high blood pressure, heart disease, and diabetes. Age and gender. Although strokes can occur at any age, the risk increases with age. Men are more likely to have strokes than women, though women are more likely to die from a stroke. Family history. A family history of stroke increases the risk, especially if the family members had strokes at a young age. Lifestyle factors. Lack of physical activity, a diet high in salt and unhealthy fats, excessive alcohol consumption, and drug abuse are all modifiable risk factors. Symptoms of stroke. Recognizing the symptoms of a stroke is crucial for timely treatment. The faster someone receives medical attention, the better the chance of reducing brain damage. The symptoms of a stroke can be remembered with the acronym FAST. Face. One side of the face may droop or become numb. Ask the person to smile and see if it is uneven. Arms. One arm may become weak or numb. Ask the person to raise both arms and see if one drifts downward. Speech. Speech may be slurred, garbled, or difficult to understand. The person may have trouble repeating a simple sentence. Time. If any of these symptoms are present, call emergency services immediately. Time is critical in minimizing brain damage. Other symptoms include sudden numbness or weakness in the legs, confusion, trouble seeing in one or both eyes, difficulty walking, dizziness, loss of balance, and severe headaches with no known cause, particularly in hemorrhagic strokes. Diagnosis of stroke. The diagnosis of stroke typically involves a combination of physical examinations, imaging tests, and laboratory tests. Common diagnostic tools include CT scan. A computed tomography, CT scan, provides detailed images of the brain and helps detect bleeding, ischemic strokes, and other brain conditions. MRI, magnetic resonance imaging, MRI, produces more detailed images of brain tissues and is often used to detect ischemic strokes in their early stages. Carotid ultrasound. This test checks for narrowing or blockages in the carotid arteries, the major arteries in the neck that supply blood to the brain. Cerebral angiography. This test involves injecting a dye into the blood vessels of the brain to provide detailed images, helping to detect aneurysms or arteriovenous malformations. Treatment of stroke. Immediate treatment is essential to minimize brain damage. The treatment varies depending on the type of stroke. Ischemic stroke. Clot-busting medications. The primary treatment for ischemic strokes is the administration of tissue plasminogen activator, TPA, a drug that dissolves clots. This treatment is most effective when given within 3 to 4.5 hours of symptom onset. Mechanical thrombectomy. For larger clots, a procedure called thrombectomy may be used to physically remove the clot from the brain using a catheter. Hemorrhagic stroke. Surgical interventions. Surgery may be required to stop the bleeding, repair the blood vessels, or relieve pressure on the brain. This includes procedures to clip or coil aneurysms or remove blood that has pooled in the brain. Medications. Drugs may be given to control blood pressure, reduce the risk of seizures, and manage swelling in the brain. Recovery and rehabilitation. Recovery from a stroke varies depending on the severity and the part of the brain affected. Early rehabilitation is key to regaining lost function. Rehabilitation may include physical therapy to help recover mobility and coordination, occupational therapy to assist with regaining the ability to perform daily activities, speech therapy to help with speech and swallowing difficulties, psychological support to address emotional and cognitive challenges such as depression or memory problems. Long-term effect strokes can cause long-term disability depending on the severity and how quickly treatment was received. Common long-term effects include paralysis or muscle weakness, often affecting one side of the body, hemiplegia, speech and language problems. Aphasia, or difficulty with speaking or understanding language, is common after a stroke. Cognitive impairment. Memory, attention, and problem-solving abilities may be affected. Emotional changes. Many stroke survivors experience depression, anxiety, and mood swings. Prevention of stroke. Preventing strokes involves addressing the modifiable risk factors. Control blood pressure. Keep blood pressure under control through medication, diet, and exercise. Manage diabetes. Proper management of blood sugar levels reduces the risk of stroke. Quit smoking. Stopping smoking reduces the damage to blood vessels. Exercise regularly. Regular physical activity helps maintain a healthy weight, reduce blood pressure, and improve heart health. Healthy diet. A diet rich in fruits, vegetables, whole grains, and lean proteins while low in salt, sugars, and unhealthy fats helps prevent atherosclerosis and other stroke risk factors. Limit alcohol. Drinking alcohol in moderation can reduce the risk of stroke. Conclusion: a stroke is a serious medical emergency that can have life-altering consequences. Understanding the causes, symptoms, and treatment options is essential for minimizing the damage caused by strokes. Immediate medical intervention, followed by rehabilitation, offers the best chance of recovery. Lifestyle changes that reduce the risk of stroke are crucial for prevention and improving overall health outcomes.